Good evening, everybody, and welcome to this evening's flu vaccination update for 2019 webinar. My name is Samantha, and I am your host for this evening. Before we jump in, I would like to make an acknowledgement of country. We recognise the traditional custodians of the land and sea on which we live and work, and we pay our respects to elders past and present. I'd like to introduce our presenters for this evening. We're joined by Dr. Vicky Shepherd. Vicky is a public health physician who has been working for New South Wales Health since 1999. Vicky's current role is Director of the Communicable Diseases Branch for Health Protection New South Wales. This role includes overseeing surveillance of notifiable diseases in New South Wales, coordinating communicable disease control activities, oversight of immunisation programs, including delivery of the school-based adolescent vaccination program, and representing New South Wales on Communicable Disease Network Australia. And we're joined by our facilitator tonight also, Dr. Tim Senior. Tim is a GP at Tharawal Aboriginal Corporation in southwestern Sydney. Tim is also an RACGP medical advisor for the National Faculty of Aboriginal and Torres Strait Islander Health and senior lecturer in general practice and Indigenous health at UWS and an RACGP medical educator. So welcome, Vicky and Tim, and thank you for joining us this evening.
Thank you very much. Good evening, everyone. Nice to join you on this Wednesday evening. First of all, we'll go over the learning outcomes, which is educator speak for what we want to accomplish this evening. So by the end of this activity, we should be able to prepare ourselves for the 2019 influenza season, understand the factors contributing to varying influenza impact in New South Wales in recent years, learn about the impact and outcomes of the 2018 influenza vaccine to children under 5 years of age, be aware of the formulations of the 2019 influenza vaccine and their optimal use in eligible age groups, and utilise the New South Wales Health Flu Vaccination Toolkit to optimise our vaccine supplies and maximise uptake of influenza vaccine. So without further ado, we'll pass over to Vicky. Good evening.
Oh, thanks, Tim, and good evening to everyone. It's good to be back. And once again, talking about flu. And I guess even though we've done this for a few years, the thing about flu is that it changes every year. So there's always something for us to learn and be ready for. So the first graph that we have tonight shows the number of notifications of influenza A and influenza B amongst New South Wales residents for the past 10 years. So influenza A is the black graph and influenza B is the yellow line. So what we see there is a number of things. In most years, influenza A is much more common. We had a very big peak in 2017, so the winter before last, you'll recall, was the worst that we'd had since the pandemic. And then we also had relatively big years in 2016 and 2014. And right over on the right-hand side of the graph, you can see the final numbers from 2018, and we had one of the mildest seasons in a long time because, you know, as the decade has progressed, we're getting a lot more testing in general practice, and so a lot more notifications of flu. And yet, despite all that testing last year, we had quite a mild season. Now, there's probably a number of reasons for that, and we'll just look at a few more features of the season, and then we can think about why that happened. So last year, these two graphs here are showing the just the 2018 experience for influenza A on the top graph and influenza B on the second graph by age and sex. So we can see that children under 10 years of age were most affected as far as the number of notifications go. And then it peaked, gradually increasing amongst mid-range adults, particularly for influenza A, but quite a lot of sparing of the elderly. And that is a feature of influenza A when we have H1N1, the pandemic virus predominant, which we did last year, that we get relative sparing of the elderly. The pattern of influenza B was a little different, so we do see a bigger a blip there in the over 85s, noting that the relative number of notifications between these two groups, there's the axis on the A is 10 times that of B. So the absolute numbers of influenza B were much less, but a slightly different age distribution. The next graph is looking at cases reported from sentinel GPs. This is through aspirin. And the dotted line is the New South Wales in blue and the national rate from the bad year, 2017. And the solid line is our experience last year. So clearly, I hope all your practices experienced a much milder flu season in 2018. It's very hard to even see a peak there in New South Wales last year. And then we've also got this graph showing emergency department activity. So the solid black line is 2018 and the pink line is 2017. So the top graph is about influenza-like illness, which is quite a specific category, and the lower graph is emergency department presentations for all respiratory and fever. So once again, different numbers of patients on the axes, but we can see again that emergency departments didn't have a lot of increased activity from flu in 2018, particularly compared to 2017. And then the final one we have on looking at the 2018 season are from our 3 sentinel hospitals, so Westmead Hospital, Westmead Children's Hospital and John Hunter Hospital, where we have active surveillance for flu. And this shows the types of the spread of the flu season last year amongst patients presenting to those hospitals with confirmed flu, and once again showing that the orange and yellow and red, which is all the influenza A, compared to influenza B, shows the predominance of influenza A causing severe disease. And while we don't have comparisons to other years, this is certainly fewer than the previous years, though we did get still get quite a lot of admissions at Children's Hospital Westmead from quite sick children.
We have actually had someone asking, has there been more influenza A in the last 2 months?
Yes, so that's right. So after that very quiet year, so last year, 2018 was quiet, and there was some really positive things going for us. First, we had a very severe year in 2017, so a lot of people caught flu in 2017, so would have had persistent protective immunity. We also had a season dominated by the H1N1, the pandemic virus, and we know the vaccine's highly effective against that. And on top of that, we distributed about 2.3 million vaccine doses in New South Wales. So we had more than 50% higher uptake of vaccine in 2018 than we'd ever had before. So we'd had an immunising event in 2017 through a severe season, then we had fantastic uptake of vaccine, and the vaccine was really well matched to the predominant virus. So that was great for last winter, but then at the end of 2018 and starting about December, we started to see increased influenza A activity up in northern New South Wales, which we thought was related to the outbreak in the Northern Territory that was going on. And then in January, we started to see returning travellers with influenza, mainly A again, both H1N1 and H3N2. And it's been quite remarkable. We see this phenomenon every year in January and February, but this year it's probably double the number of notifications we've ever seen, and it has persisted into March. So that has an impact on what we need to do to prepare for the 2019 season, which we'll get onto in a minute. So just finalising 2018, despite a mild season, we identified at least 43 deaths, including in one previously healthy young child. And there were very few outbreaks in aged care facility compared to other years, only 46, whereas in 2017 we had over 500. So what do we expect this year? So in North America, has had a similar season to what we saw last year, mainly H1N1. Europe has also had a milder year, but has both types of A circulating. The vaccine's been updated, so the H3N2 component has been updated to a strain to better match what's circulating, and also the B component of the 2019 vaccine's been updated. So we expect that the vaccines that are manufactured for us this year will be very effective again against H1N1 and against the B strains, and it's a bit of wait and see about how the H3N2 component will perform. Also good news, the circulating virus has no resistance to Tamiflu, so it will be effective. But as we started to say, these high levels of summer flu that aren't going away, we don't yet know if that's going to finally start to decrease or will keep on at this level and then start to increase. And we'll talk a bit later about how we're going to manage the vaccine distribution strategy to deal with that. And because of the strains that are likely to predominate, we expect once again the elderly and young children to be most affected in 2019. So how do you keep up to date with what's happening about flu? We issue monthly reports until May, and from May we issue weekly reports, and they're on this webpage. So if you want to know what's happening with flu and see all these graphs about and information about the various indicators, please use that webpage. So still staying on 2018, what was the impact of flu in children under 5? So they had the highest rates of hospitalisation, so similar to those over 65. We observed complications such as pneumonia and encephalitis. Every year we have deaths reported in children from flu, so there's been 20 deaths in 13 years. And we had at least one last year. And what we do know about flu in children is that death is not restricted to children with high-risk medical conditions. It just equally affects previously perfectly well children, as we saw last year in New South Wales, and has already been seen this year in Victoria and Western Australia, with previously well children dying from flu already. So how did we do with our flu program last year in New South Wales, the under 5 flu? So we distributed about 250,000 doses of flu quadri junior to general practice, and about half of those had a record in the Australian Immunisation Register. So the data that we're showing now is from vaccines that GPs in New South Wales reported to the register for flu last year. So on the left we have graphs about Aboriginal children, on the right is non-Aboriginal children, and we're looking at age groups 6 months to 1 year. In yellow, blue is children 1 to 2 years of age, red is children 2 to 3, and grey is children 3 to 5. So there's a number of things we can see. So infants 6 months to 1 year of age had achieved the highest reported vaccination rates in 2018. So 35% of them received at least one dose, which is very, it's a great uptake for the first year. About 30% of one-year-olds received a dose, and then about 24% of children 2 and over received at least one dose of vaccine. So that's, I think a very good start to the first year of the program, because GPs and parents were all learning about it. And I think we realised that reporting to the air is still not kind of routine for non-national immunisation program vaccines. So we don't know the extent of underreporting. And I don't know, Tim, if you have any comment, if you're aware of how routinely these vaccines administered to children, flu vaccines, might have been reported to the air.
I'm not sure. I'm thinking about our own service, and I think you're right. I think it would have been less routine than the childhood vaccination program, because the systems would be, these are probably more likely to be reported than adult vaccines. So I suspect it's a reasonable representation. We do have a question as well, just wondering if fortunately the small number of deaths in children, did they occur in non-immunised children?
That's right. So going back to that, so the graph, for example, where I showed the admissions at Children's Hospital and Westmead and John Hunter, most of those were children. Only one had received the vaccine, and that was a child that was medically indicated, I think, lymphoma or some condition that made them highly susceptible. So that was the only child that was admitted that had received a flu vaccine. So the vaccine's obviously not going to provide 100% protection. The vaccine effectiveness that was calculated was about 75% for children. So that's, 3/4 reduced risk of being hospitalised with flu if they were vaccinated last year.
Yeah. When pharmacists give immunisations, do they go up to the immunisation register? I'm not sure they have access to it, do they?
They do. Pharmacists are actually in New South Wales. For a pharmacist to be allowed to vaccinate, we require them to report to the register. Pharmacists are not allowed to vaccinate children, so only people 16 years and over can be vaccinated by a pharmacist.
Excellent. Thank you.
I guess the other really pleasing thing about these graphs is that, the coverage in Aboriginal children is actually higher than non-Aboriginal children. And prior to this year, prior to 2018, even though flu vaccine was free for Aboriginal children, we were only getting less than 5% vaccinated. So having a program that's available for all children has, greatly improved the coverage for Aboriginal children as well. So that's another positive we see from 2018. So that's about all I was going to say about 2018. Are there any other questions about that, Tim, that we should touch on?
So someone asking what strain was responsible for the summer outbreak?
The summer outbreak is A, and it's about 50-50, H1N1, and the other half is the H3N2.
Lovely. Thank you. The other questions we've got we'll cover later on in the presentation.
Okay, well, I'll go on to this year then, to 2019. All right, so the Chief Medical Officer has issued advice, and I think you've received a letter from him, or should have. So continuing to advise that annual vaccination is the most important measure to prevent flu and its complications. Annual flu vaccinations recommended for all people 6 months of age and over. We have very important new funding information that all Aboriginal people 6 months and older are eligible for free flu vaccine. So before there was a gap, Aboriginal children from 5 to 14 weren't funded. Now that's been changed, and the Australian government's funding vaccine for all Aboriginal people 6 months and older. And then, similar to last year, the optimal protection against flu occurs in the first 3 to 4 months following vaccination, and that's, I guess, most important for the elderly, which is why we're recommending vaccination in April or May. And the full statement's on the department's website, and we anticipate that the annual statement from ATAGI, the Australian Technical Advisory Group on Immunisation, will be published very shortly to help support vaccination practice this year. All right, so mentioned this already. So the vaccine in 2019, the 4-valent vaccines cover 2A strains and 2B strains. And the trivalent vaccine, which is Fluad, will cover 2A strains and the Yamagata B strain, which is the Colorado lineage, Yamagata lineage and the Colorado strain. So there's 2 new parts of the vaccine. So the vaccine's available, I think, a little less confusing than last year, but still requires some concentration. So under government-funded programs, we've purchased Flu Quadri Junior for children 6 months up to 3 years of age. So that's the same vaccine that was used last year, and it's 1/4 ml. There's also 3 other 4-valent vaccines. So there's Flu Quadri and Fluarix Tetra. Now, they're on the national program for people 3 years and older, but important to note that the registration of Fluarix Tetra has changed. So it's now licensed for 6 months and older. So that gives a bit more flexibility, and we'll talk about that a bit later. Also, the Afluria Quad, the Australian manufactured vaccine, has a change in its age indication. Before, last year, it was only for people 18 years and older, but now it's licensed and on the NIP for people 5 years and older. So I'm sorry about all those changes, but it probably does give a bit more flexibility with the vaccines that are available. And it's good to know, so the Afluria Quad was like the old Fluvax that CSL manufactured, and you'll recall that we had the problems in 2010 with febrile reactions with children, and for a number of years, well, since then, haven't used it in anyone under 10. There's now a lot of data from the United States in particular, where this vaccine's been used in thousands of children, and it's really quite safe. So that's why it's now licensed down to 5 years of age in Australia. And for the over 65s, this year there's only one vaccine available on the NIP, that's Fluad. So we had that one last year. That's the vaccine that has an adjuvant in it. So that's only licensed for people 65 and older, and that's the preferred vaccine for people over 65 and over on the NIP. The other one that we had last year, Fluzone High Dose, is not on the NIP anymore, but it will be available by prescription via pharmacies, but obviously patients would have to pay for that. So the ATAGI recommends that these 2 vaccines, there's no preference between them, but they're both preferred to the quadrivalent vaccines for people over 65. So the strong recommendation is to use Fluad for people 65 and over. So you've probably seen this. It's part of the Commonwealth materials that summarises that, the slightly, the varying age groups and eligibility of the 5 vaccines that are on the National Immunisation Program. Noting that the Fluarix Tetra, while it's currently not on the NIP for anyone under 3 years, it can actually be used for children from 6 months of age. Okay. I see some questions there about the trivalent vaccine, but maybe we'll talk about those as we go through each of them.
Yeah, that's what I was thinking.
Yeah. So this is the pack shot of the under 3 vaccine, the flu quadri junior. So because of New South Wales funding, any child aged from 6 to 35 months is eligible for this vaccine free. If it's their first year of being vaccinated, they should have 2 doses, 1 month apart. And we do know there's an increased risk of febrile reaction if it's given with the pneumococcal vaccine, which is, of course, due at 12 months of age. So it would be parents would need to be warned about that, and perhaps using Panadol prospectively, or separating the doses if a 12-month-old presents for flu vaccination. So this is Fluarix Tetra. So
sorry, can I just
yep.
Just one question about the previous one. Someone's just confirming, asking, can you use half of flu quadri for flu quadri junior?
No, you can't. But you can use Fluarix Tetra. And the dose for Fluarix Tetra, irrespective of age, is 0.5 ml. So there's no half doses. So I guess that's a simple message that we can remember. There's no half doses. You either use Flu Quadri Junior, or if you are using Fluarix Tetra in a child under 3, you still give the full 0.5 ml. But just remembering, in the New South Wales program, children eligible, we haven't funded vaccine, so we should be using the Flu Quadri Junior that we've purchased for those children, even though, as far as registration goes, this Fluarix Tetra could be used under 3. Well, it's only free for children 6 to 59 months of age if they're eligible on the NIP. It's free for all Aboriginal people 5 years and over, pregnant women, people with medical risk factors from 5 to 64 years of age, and once again, if you're vaccinating children from 3 to 9 years of age, the first year they receive a vaccine, they should have 2 doses a month apart, and both doses are funded. Flu Quadri, it's free for all children in New South Wales from 36 to 59 months of age, all Aboriginal people 5 years and older, pregnant women, people with medical risk factors, and once again, 2 doses a month apart in the first year, and don't give a half dose. It's not licensed for that.
So just on those 2 doses, someone's asking if someone has just 1 dose and misses the second, do they get 2 doses the next year, or do we just carry on single doses?
That's right, Tim. If they don't get the second dose the first year, the next year they just get 1. So they will have had less than optimal protection the first year they were vaccinated, but from then on they'll get optimal protection from 1 dose. And here's the Afluria Quad, so noting it's available 5 years to 64 years on the NIP, so for Aboriginal people, pregnant women, medical risk factors, and then children 5 to 9 who might be eligible because they've got medical risk factors, they would need 2 doses. And please don't use it under 5. It's not licensed for people, for young small children. And here's the Fluad. So this is licensed only for people 65 years and older. Just 3 strains of vaccine, 3 strains of flu in there, and it has the adjuvant. So there's a couple of questions in there about why to use this instead of the quadrivalent, and the advice from our experts from ATAGI is that this is preferred because of the enhanced immune response that's created by this vaccine. The B strain that is in there is the one that was circulating last year and still seems to be circulating, so it should be providing the best protection for people over 65. We'll of course be monitoring closely the strains that are circulating, and if there's any concerns that we're having a predominance of the Victoria strain, we'll of course provide any updated advice from ATAGI, but at this point in time, this is the recommendation for the over 65s. Okay, so I think I've pretty much covered the material in this slide. So you could tell your patients that this vaccine provides around a 25% better protection than the standard flu vaccine. So a number of very large studies have shown that. So that's why it's preferred. No flu vaccine is, obviously anywhere near 100% effective. So we're looking at relative performance. Fluad recipients might get a more marked local reaction than people having a quadrivalent vaccine, but that's because of the enhanced immunogenicity. And as I said before, the Fluzone high dose, which is quadruple the strength rather than having an adjuvant, is only on the private market this year.
And is there any danger if that's accidentally given to someone under 65 years of age?
Well, there's no studies to know, and that's why it's not licensed under 65 at the moment, Tim. So, we do get a lot of inquiries about, immunocompromised patients under 65 and could they have it. I'm afraid it's at the moment an evidence-free zone. So we can only recommend what it's licensed for and what studies show. So we really don't have any information on that. I'm aware that there are studies underway on younger immunocompromised and otherwise susceptible people, and once that data comes in, then we can make recommendations. So other changes in 2019, as you've already highlighted, appropriately trained pharmacists can provide flu vaccine to persons 16 years and older. But we've already talked about how pharmacists are required to report all vaccines given to the Australian Immunisation Register. And they're also required to advise patients if they're eligible for a free vaccine via their GP. So I hope that's all in place. So I was just going to go on and talk a bit now about planning for the vaccination program this year. And we've had very good feedback last year from RACGP and AMA. They helped us with a debrief, and we also got feedback from public health units. It was quite a staggering year. As I said, with 2.3 million vaccines distributed. So we've made some changes to how we're doing things this year, and I hope it assists practices in preparing and managing the flu vaccine program. So we've produced a flu vaccine provider toolkit, which is on our website. It has a checklist there that is meant to help you prepare your practice about what you should be doing when to get ready, and including when to place orders and so forth. There's a decision aid in the toolkit about assessing adult patients for flu vaccination. And we've also provided a workbook, which there's a link. You can download the spreadsheet from our website. And because some of the feedback we got last year was people didn't know how many vaccines to order. They were running out before we could resupply. So basically, with the number of practices in New South Wales, it takes us 3 weeks to get vaccine out to all those practices. So the worksheet helps you estimate the number of patients in your practice that need to be vaccinated, how many you can vaccinate per day, how many to order in your first order, and then how many to order in your subsequent orders, so that you can maintain enough stock to meet the expected demand. So we hope that's helpful, and something we'd really appreciate feedback on, and we'll obviously be talking to RACGP and AMA again at the end of the season to get feedback as to whether this helped us all cope better with this very busy time of the year. But that said, we always have to be a little bit flexible with flu, and we would normally have what we flagged in this toolkit is that we are going to start distributing mid-April. But because of the level of influenza that's still circulating, particularly affecting aged care facilities, we've already got our supplies of Fluad in, so we're actually going to start distributing to aged care facilities tomorrow. And we should have enough Afluria quad in by next week, so we anticipate starting to deliver to general practice next week. So we will be...
Someone's asking, apparently pharmacies already have their supplies in, is that right?
Yeah, well, pharmacies purchase from Seqirus, and Seqirus is, because they're an Australian manufacturer, they're the first ones with flu vaccine available. So we've just received our Fluad today, and we anticipate having a good supply of Afluria quad by next week. So it's very likely that pharmacies are also getting those vaccine. Well, they won't have the Fluad, but they'll have Afluria quad and maybe Influvac, which is another vaccine that's not on the NIP. So yes, pharmacies will have vaccines now. So we will be sending a fax out to all GPs, fax and email, probably tomorrow, to keep you updated about when to expect your deliveries. But I guess the strong message is that don't actually book in any clinics until the vaccine's in your fridge. Prioritise the elderly and pregnant women once you receive appropriate vaccines for those ages. We're probably going to have to wait a couple more weeks before we've got vaccine for children. But as soon as you do get that, really encourage you to be vaccinating children as well, because we're seeing a lot of impact on children and the elderly at the moment. So also to help managing the program, we're producing similar resources to what we produced last year, and we'll send these out with vaccine deliveries. So there's a poster that illustrates the vaccines and the indications that you'll receive, and also the stickers to go on the baskets for your fridge to help you more readily find the vaccines that you need to use. And we obviously might have to amend these a little bit because of the changes for Fluarix Tetra. Okay, we're running a similar campaign to what we ran last year, so using the same kind of idea about preventing flus in your hands, getting vaccinated, keeping your hands clean, and staying at home. So again, those posters will come to you with your vaccine delivery. But one of the lessons from last year is that we won't be strongly promoting vaccination until May, because we want to make sure that all the vaccine is available in general practice before we're pushing people to get vaccinated. But as I said, once you receive vaccine, we'd like you to be vaccinating your older patients, your pregnant women, and children once you get the vaccine that's available. So a practice checklist. So certainly if you haven't already ordered your flu vaccines, make sure that you do that now. Be checking your cold chain measures and making sure that the fridge has space for the vaccines that you're ordering. We have in the toolkit, we've got dimensions of the various packaging of the vaccines to help you estimate how much space they're going to take up. I think it's, giving this information to all your staff, particularly your vaccinating nurses, so that they're familiar with the different age indications for the different vaccines. Upgrading your practice software is important because that's how you're able to then automatically choose the vaccines that you're giving to then automatically report to the register. Don't forget to vaccinate your practice staff so that they're protected. And plan to maximise uptake, particularly in children and pregnant women. But all the priority groups, Aboriginal people, people with chronic conditions, and the elderly. If your patients have questions about flu vaccine safety, the AUSVAC safety system is now very reaching a lot of practices across Australia. So, for example, last year there was 16,000 children who participated in the flu vaccine safety report. So this is when the practice software automatically sends an SMS to the parent a few days after vaccination asking them if there's been any adverse event. So of the 16,000 children who were part of that surveillance last year, almost 94% the parents said no, nothing happened. Of the 6% that did report some kind of an event, it's mainly the expected things, a bit of swelling at the injection site, 2% had a fever, and less than 1% sought medical attention for the adverse event that happened after vaccination, and which may, of course, not even be related to vaccination, but they had seen a doctor. So that's, I think, reassuring to parents, and this Smart Vac system is still available if your practice wishes to participate in it. And we've talked about that before, Tim. I don't know if we need to cover.
We have, that's right. We've got quite a few questions come through, so we might just, some of them we might cover during the case studies, but I think there's some themes. So if it's all right, I'll just we'll just take a moment to answer some of those, if that's okay.
Yeah.
One is about contraindications to vaccines, if there's any new contraindications or particular contraindications that we need to be aware of.
Yeah, so the only contraindication to flu vaccination is prior anaphylaxis to flu vaccine or any of its components. There are precautions. So prior, if you previously had Guillain-Barré, then would seek specialist advice before vaccinating. And of course, severe egg allergy is also, severe anaphylaxis to egg is a precaution, and people with egg anaphylaxis or egg allergy can be vaccinated under medical supervision. So as long as you've got an adrenaline kit and observe them for half an hour afterwards, or you could refer them to the specialist immunisation service at Westmead Children's Hospital, where they can egg allergic children can be vaccinated in the specialist clinic.
Excellent. We've got a few questions coming about the timing of flu vaccine with other vaccines, for example, pneumococcal vaccine, at different age groups or special populations like patients who've had a splenectomy. What's the advice on the timing of influenza vaccine with pneumococcal vaccines and with childhood immunisation vaccines?
Yeah, so pneumococcal is the Prevnar is the only vaccine where there is a precaution about increased risk of fever. So all the other childhood and adult vaccines, flu can be given at the same time, and there's no indication of any increased risk. For people who've had for example, hematopoietic stem cell transplant, they should have 2 vaccines in the first year that they're vaccinated against flu after their transplant. But otherwise, immunocompromised people don't require 1 dose of flu vaccine. Of course, they may not get the same response to others, but only one dose is recommended, except for those people who have had basically their immune system wiped out.
Yeah, lovely. And quite a few people are asking a question that's asked every year, I think, about the any recommendation for giving 2 flu vaccines several months apart to cover the later part of the flu season, or a winter or a summer flu season?
Not for winter flu, but I believe when the ATAGI statement comes out, there is consideration if someone's travelling to the Northern Hemisphere, then the second for our summer, then a consideration of a second dose, either of leftover Southern Hemisphere vaccine or the new Northern Hemisphere vaccine, if available, could be considered.
Yeah, but it's not a routine recommendation to do that, even if the coverage tails off towards the last few months.
No, not at the moment. But once again, we need to be closely monitoring what's happening, and additional advice could be issued at a later stage.
Yeah, because my understanding, that's an evidence-free zone as well. Some people are recommending it, but there's no real evidence either way, is there?
That's right.
Yeah. Just looking to see. There's a few questions about how well the vaccine works in breastfeeding mothers, and if there's any special a particular flu vaccine we should be recommending, or and how effective it is in breastfeeding mothers.
Yes, it's as not a lot of studies, but the expectation is it's just as effective in a breastfeeding person as it is in other people. Of course, it's not funded, but it would be recommended. It would contribute to protecting the infant. Sorry, what was the other part of that question?
Yeah. It was how well it covers.
Yeah, it'll be highly effective and would contribute to protecting if the infant's too young to be vaccinated. Vaccinating a pregnant woman would be a breastfeeding woman would be recommended, but that's not funded.
Yeah. Let's move on to the case studies. I'm just aware of time. There's some specific questions coming through that may be covered in the case studies as well. All right.
I just see that there's a frequent question about asthma and eligibility, and
yes.
I think that's been tidied up in the handbook a bit now. So what the handbook says is if someone's under regular medical care or on regular medications, then they're eligible. So someone who's on a regular preventer, or if they've been hospitalized for asthma, would be eligible for influenza vaccine. So not someone who just has a puffer in the side drawer that they might use once a year, but if you've regularly got them on a preventer, then they would be eligible. All right, we'll go to the case studies. So here we are in April 2019. So Linda, a 31-year-old woman, recently moved to Australia from the UK, and she's 36 weeks pregnant. Now, she received the flu vaccine in January before she left the UK. And she's also, Linda's daughter, who's 2-year-old, is with her, and she's got a non-anaphylactic egg allergy. So there's a few issues there. So what would we do? Well, we'd recommend offering her the 2019 flu vaccine because the Northern Hemisphere vaccine she received in January isn't attuned to the same strains that we're going to have here, and that's free for her. So you could use Flu Quadri, Fluorix Tetra, or a Fluria Quad. And please check her pertussis vaccination status. So she can receive that anytime in her second or third trimester. But she's 36 weeks, so it's last chance for her. And her daughter, being 2 years old and in New South Wales, is eligible for free Flu Quadri Junior, and that's a great idea to vaccinate her, because by vaccinating her, you reduce the risk of bringing flu into the home when there's a new baby. So she's non-anaphylactic allergy to eggs, so that's quite straightforward, receiving the vaccine. Just make sure you've got an adrenaline kit prepared in the practice, and observe her for a half hour afterwards. And if this is the first year she's receiving flu vaccine, book her in for a second dose 4 weeks later. And if there's a dad on the scene, then be good to vaccinate him as well to contribute to protecting the infant when they're born. So is that okay, Tim? Any questions about that?
Not so much about that. There's a few questions about access to Northern Hemisphere vaccines and how different that is to the Southern Hemisphere vaccines.
Oh, yeah. So that's for the travellers? Yeah, well, it's probably rarely available in Australia. There may be some travel clinics that do import it. But, for example, people often go away for several months, and if they're travelling in November, they could get vaccinated when they arrive in the Northern Hemisphere. They'd have to pay for it, but that would be a way to optimise their protection if they're travelling next summer.
Yeah.
All right. Second case study. I'm running out of time now. 12th of June 2019, Owen. He's a 2.5-year-old child. He's had a hematopoietic stem cell transplant about 8 months ago. And he's going back to childcare in 4 weeks, and his mum is very anxious. So he's at home with his mum, dad, his 4-year-old sister, who attends preschool, and a brother who's in primary school. Now, he was vaccinated in 2017 and received 2 doses then when he was just 6 months old. So what are we going to do for Owen? So Owen should be offered free Flu Quadri Junior. He's 2.5. And because he's had the hematopoietic stem cell transplant since he's previously vaccinated, he needs 2 doses again, so he's got to start again from scratch. So book him in for a second dose in 4 weeks. Advise mum that she's not eligible for free vaccine, but she would help protect Owen if she does get vaccinated, and suggests that dad and the primary school brother also get vaccinated to assist in protecting Owen. And, of course, his 4-year-old sister is eligible for a free vaccine, so she should come in and get that. Is that straightforward? Or any questions? Okay, I just saw a question there. If a pregnant patient received flu vaccine
That's right.
in 2018, should they be vaccinated again in 2019 when it becomes available? Yes, and please vaccinate them as a priority as soon as you get the Afluria Quad. Case study 3. So we have a family here. So there's a father who identifies as Aboriginal, a mother non-Aboriginal, a non-Aboriginal grandmother, a non-Aboriginal adolescent, and 2 Aboriginal children, 3.5 and 7 years of age. And they all turn up. So how are we going to approach that? So dad is Aboriginal, so he's eligible for free flu vaccine. He's a smoker, but he's eligible anyway. So you could give him Flu Quadri, Fluorix Tetra, or a Fluria Quad. Grandma's not Aboriginal, but she's over 65, so she's eligible for funded vaccine, and you should give her flu ad. Mum's not Aboriginal. She has a history of breast cancer, but she's not medically at risk, so she's not eligible for free vaccine, but would be recommended to have privately funded Flu Quadri, Fluarix Tetra, Afluria Quad, or Influvac Tetra. The daughter, 15, non-Aboriginal, no medical indications, so once again not funded, but is recommended to be vaccinated. The two children, both Aboriginal, so the 3.5-year-old is eligible for funded vaccine. You could use either Flu Quadri or Fluarix Tetra. And the 7-month-old infant is eligible for free vaccine, and you'd use Flu Quadri Junior, or you could use Fluarix Tetra, a full dose. So that's the 3 case studies. Tim, sorry, I'm cutting.
No, that's excellent.
Finally, time.
Yeah, you've done brilliantly with time. A few questions, just clarifying about the 2 doses for children. It's only if it's their first flu vaccine that they have 2 doses a month apart. Otherwise, it's just 1 for the year. Is that right?
That's correct.
Yeah. And a scenario here: what if a pregnant mum had their vaccine in, say, November and delivered in April? Should they have vaccine to cover baby while breastfeeding? I think yes.
Yeah, it's not eligible. I try and vaccinate them before they delivered. But after that, yeah, certainly it would be advisable. But unfortunately, once they're not pregnant, they're not eligible for free vaccine.
Yeah. And we have had a few questions about treatment, just about the use of antiviral treatment and whether people should take swabs.
That partly depends on the stage of the flu season. If there's a lot of flu around and people are presenting with a very clear clinical picture, then it's not necessary to confirm. At this stage of year, there's actually more RSV circulating than flu. So unless the picture was very clearly flu, so the myalgia, the headache, or they'd been overseas or they'd contacted with a case, you might need to do the swab to, make your clinical decision about whether it was flu or something else. But if your clinical acumen thinks flu is most likely, then certainly Tamiflu would be worth trying.
So I was asking a good question. If Linda, in that first case, doesn't have Medicare yet, is she still eligible for the New South Wales vaccine program, for the free vaccines on that?
Yes, in New South Wales, anybody who is in New South Wales can receive the free vaccines under our programs, because we're contributing to herd immunity as well as protecting individuals.
Yeah. A few more questions about dosing of giving different doses a few months apart, or a month apart, or a second dose a few months later, which I think we covered earlier. Again, pregnant women can be vaccinated at any stage of pregnancy, can't they?
Yes, they can, and they should be vaccinated as soon as possible in pregnancy.
Yeah, and we've hit 8:30. We're still getting so many questions coming through. I think if people feel that we haven't covered their question, then it's worthwhile emailing them through, and we'll see what we can do to answer those. I'm keen that we do finish on time. The slide up at the moment is the learning outcomes. So hopefully, looking at those, we've achieved this tonight. That we're feeling a bit more prepared for the 2019 influenza season. Those resources will certainly help with that. We've understood the factors contributing to varying influenza impact in New South Wales over recent years. We've learned about the impact and outcomes of last year's vaccine to children in the under 5 years of age program. We're aware of this year's formulations of vaccine and their optimal use in eligible age groups, and we'll be looking forward to receiving our New South Wales Health Flu Vaccination Toolkit so we can optimise our vaccine supplies and maximise our uptake of influenza vaccine. Vicky, thank you very much. That was a marvellous presentation. I think we've all learned heaps. Sammy, thank you very much for running the system and making it all run very smoothly underneath. Hope everyone has a good evening, and don't forget to fill out your evaluations.
Okay, thanks Tim, thanks everyone.
Great.
And yeah, the presentation will be available online.
Great, thanks Tim and Vicky again for joining us this evening, and also to everybody online. We do hope you enjoy the rest of your evening.